biting question today is, do you have the flu?
No.
Did you get a flu shot?
You know what? I've never gotten a flu shot. I
Wait.
know, but I don't have the flu.
Wait. There seems to be a logic there somewhere that escapes me.
There's a little logic in my mind.
All right, listen, I'll tell you what.
Okay.
Before you decide that you're never going to get a flu shot,
okay,
will you please listen to the good doctor that I have visiting us?
I will.
It's about how to avoid the flu. One of the reasons that you can do that is get a flu shot.
I know. I should go get one.
Yeah, just think, I'm with Danielle now several days a week. And then she informs me now that she could possibly be diseased. She didn't get a flu shot. Doc, what are we going to do about that?
Say it isn't so. Please, please.
No, I mean, I can't believe I get 11 a day. I don't take any chances at all. Dr. Ken Redcross is here, board-certified internal medicine doctor, concierge doctor, and he's here to take care of our flu problems. One of mine is called Danielle.
Oh, wow. Well, that, I don't know if I can necessarily fix that one.
Well, what about the rest of the Danielles? And, sadly to say, my wife, too, who are carrying on these flu shot myths.
Yes, yes. There are a lot of flu shot myths. I think the biggest one, Pat, is that the flu shot actually got you sick. Let me tell you, the flu shot is already a killed, inactivated virus. So let me tell you, that's not happening. Now, can you feel a little bit down or a little bit flu-y when you get it? Absolutely. But that's really just your body mounting a response in case it sees the real flu. But that is a myth that everyone can totally get rid of this morning.
Yeah, so if you're looking at a companion in the office and all of a sudden you have to say, funny, you don't look fluish,
right,
but you may be because you didn't get a flu shot. Can we convince people if they just simply don't want to do it?
The way I usually do that is two ways. You think about your kids, if you have kids. Yeah. So you have to think about that. It's not only you who you're actually trying to protect. The second way I do that is, what if you have any family members close by, grandparents, older parents who have other medical illnesses? Think of them as well. Now, keep in mind, Pat, my practice is very holistic, so I'm not always great as far as getting the flu vaccine or talking to my patients about it. Okay. But this year, we nailed it. So we got a good vaccine this year.
Holistically and with the vaccine, and what is in your package of remedies?
Oh, well, I am glad you asked. So I have a flu survival kit, I call it. Now, this is great when you already come down with symptoms. The CDC says no matter what we do, we're all destined for 2 or 3 colds. So this is what I think we should do when we start to come down with those symptoms, starting with a probiotic. Now, we've all heard of probiotics, and we know that they're good for us, but we may not understand that when we get sick, we lose a lot of the good bacteria in our gut that is extremely important for our immune health.
So these are some of the items that you have in your anti-flu pack. By the way, we know about antibiotics, but do we really understand what probiotics do?
You know, it's funny. We have some good data that at least it works. Some good studies that show 34% of, at least this was a student, college student study that showed 34% of those students got better and felt better quicker when they took a probiotic.
What else should we take?
Well, we also have Oscillo. Oscillo is a homeopathic remedy, which I love. It's been in Europe for over 50 years. It's all natural, and it's been shown once again in studies to be able to decrease both the severity and the duration of illness. And even better, it's good for kids 2 years of age and older.
Oh, great, because a lot of times, a lot of the medicines for flu are not good for kids. But do I get Oscillo at health food stores?
Actually, you can find it at health food stores, grocery stores. It's easy to find. It's everywhere now.
Keep going. It looks like you've gotten halfway through the pack.
Absolutely. The next thing we have here is good old chicken noodle soup, Pat. Just more proof that Mom is always right. And so we need to give Mom a call and apologize to her for anything else and say, Mom, the good doctor said you were right on point.
Okay, did Campbell's Soups pay for your trip? Is that why you're promoting it?
I swear to you, absolutely not. I have 0 stock, but I'll tell you this. We do know that chicken noodle soup slows the migration of white blood cells to those areas that can wreak havoc, such as to our chest when we get a cough, or to our nasal passages where we start getting a lot of that sneezing. So in fact, chicken noodle soup itself is actually really a medicine.
Is it chicken noodle soup or any kind of chicken?
You know, that's a great question, Pat, because we're trying to figure out why it's so effective. I don't know if it's coming from the bone part, the bone broth itself. We just know it works.
Wow. And we didn't pay attention to Mom before.
We will now.
Okay, do we have anything else?
We do. Last but not least is zinc. So zinc itself is a mineral that's essential for the immune system. So therefore, it makes sense that should we come down with something that we have zinc on board to kind of boost our immune system back to health. Some wonderful studies with that as well. The only thing I would caution everyone is make sure you have something on your stomach. I love zinc, but it will kind of upset your stomach if you don't, but that should not discourage anyone from trying it.
Do you hear those voices across the state of Arizona? They're saying, well, wait a minute. Didn't they say something about the fact that he was an MD? He sounds like a naturopath.
No, I know.
Or one of those other folks.
Let me tell you, it's like I've seen the light. You know, I'm a Columbia-trained Western physician, and I saw people got better with natural remedies, and so that's the space I love, and that's the space that all my patients love.
Listen, doctor, you were talking about the fact that no matter what we take, some of us are going to get a cold sometime during this season. How can we tell the difference between a normal cold and the flu?
Yeah, that's a great question. The best way I usually say is that once you start getting body aches and the higher grade temp, that should clue you into a little bit more of the flu itself. Think about a cold as being more upper respiratory, stuffy nose, runny nose. The flu can have those symptoms as well, but when you're talking about those horrible body aches and that low-grade fever, you should get on the phone with your doc and really have a discussion about the flu.
You know, it would be terrific if we could go back to the original part where I'm saying whether it's Danielle or whether it's my wife or whether it's somebody in your family that's not getting a flu shot. One of the things that people say is, but wait a minute, hold it. I've been reading there's a different shot for different strains of flu.
Yeah. So there's a newer vaccine that we have. So we have a trivalent and we have a quadrivalent. The trivalent covers 3 strains and the quadrivalent covers 4 strands. Once again, this year so far, we've done a pretty good job. The flu season's been quiet, but I caution everyone once again, the flu season can go all the way out to May. So we're only halfway there, guys. So we just need to make sure that we stay vigilant, keep hands washed, make sure the stress is low, and get rest.
If your family doctor says, where did you hear about that kind of stuff? Just tell him, Dr. Ken Redcross on the Morning Scramble. It must be true.